So first I want to thank Stefan and Boo and Leah, I think she's left, but others for actually making it possible for me to come. I'm very excited to join, and I'm also really appreciative because this is going to be, you're going to hear a couple things from me today that are actually not coming from V-Dem data. So Stefan sort of allowed me to interlope and hopefully to get your feedback and thoughts on some things and share some work that we're doing. This first is from a project, the project on governance and local development, which will also be moving to Gothenburg with me. It's a paper done with Jemana Alaraf at the World Bank, with Hans Luters, who's a researcher and assistant of mine at Yale, and then myself. And what we're interested in is a question of what explains health and education. We think of it, and I want to be really clear about this, we think about it in terms of service provision. A lot of people talk about the quality of service provision, used as the kinds of indicators that we're looking at here, which are indicators on the one hand on education scores. These are the indicators from the TIMSS scores. And on the other hand, they often use things like infant mortality, non-communicable disease rates, and others that sort of really, essentially what are really outcomes in order to think about how well countries do. So looking at the first, this is again the TIMSS, the 8th grade scores from 2011, and what we find is of course very interesting. Generally there's a notion that higher GDP per capita is related to better outcomes. That's a kind of this normal notion, and the reason that we think with dividing the poor and the rich countries, and we've seen some of that. What we find is the OECD actually does quite a bit better in terms of education than these are. This is Saudi Arabia, UAE, Qatar, Oman, and Kuwait. Also very wealthy countries, but when it comes to education, actually quite below the international mean in terms of their outcome. Now, on the other hand, when we look at health, we find actually very different outcome. We find that the Gulf countries are doing much better in health than others when we take into account their per capita levels. And the question is, why is this? I mean, first, why do we see these differences? But the second is, if they can do really well in health, why can't they do really well in education? What's going on here that helps to explain these very different outcomes in service sectors? And one of the things I want to note that we think is important about this research is the fact that we're trying to point out that we often sort of lump together different sectors and think that the same kinds of things that drive one will be driving another, and we think it's really important to start disentangling that and thinking about the ways in which these are in a sense sort of very different, both institutionally but also in terms of some of the kind of the business practice of them. So the conventional story to explain this, when we take into account all sorts of other things, including elevation levels and GDP per capita, et cetera, is to say that places where we have strong state institutions, are able to have good outcomes. That's the sort of the conventional wisdom, is it's a supply side story. Those are the places that can supply the high quality sort of services, and that's what we get. And of course, what's interesting is that it should mean that you get high health outcomes and high education outcomes. There shouldn't be any differences across sectors when you take that story into account. What we think actually happens is we don't disagree. It obviously matters whether or not you can supply, but it also matters whether or not there's a demand for the service, right? So it's not just a supply side issue, it's a supply and a demand side issue. And we think this is a demand side story, not just for health and education, but frankly for all sorts of services, has been largely underrated and underappreciated. And what we argue is that we get individual and actually sort of country sort of expectations about why people will demand one set of services and why they have less of a demand for another set of services. And for our purposes, the Gulf is particularly useful because what happens in the Gulf is that people have essentially very high safety nets in terms of social expectations. So they know they're going to have, whether or not they have the skills, they're going to have a relatively, if they're national, they're going to have relatively sort of stable level of income, they're going to have health service provided, they're going to have essentially kind of fairly high standard of living regardless of how well they've done in school, okay? We gotta make an assumption that we don't think that people in wealthier or less wealthy countries or in these different sort of economies have that much difference in terms of health. They'd all prefer to actually have better health, right? But what we do think there is a sort of systematic difference in is if education isn't gonna buy you much, then you're not likely to want to invest in it much. So it doesn't become from an issue then that you don't have the schools. In fact, if you've been to the Gulf, you know that they have very good school infrastructure. It comes from the fact that students don't want to study, and frankly, parents are not very interested in having their students study. It's a reason why one of my co-authors was a bit worried about what the Gulf was going to think of her. So what we do is we look at a couple things. We do sort of cross-sectional analyses using the TIMS data that I showed you earlier. Using on the health side, we use a series of different data. We look at sort of the daily expected rates, but with non-communicable diseases, we look at infant mortality, etc. And what we generally find is that the countries that have the higher per capita resource endowments, right, these that actually have essentially kind of these large safety nets for people, have less educational outcomes. Okay? And you saw that in the scatter plot earlier. And that's when we take into account all of these other sort of things, and I'm happy to share the paper with you, that we expect influence your kind of outcomes. On health, on the other hand, we don't find any effect. And I should mention that this is even taking into account the idea that's out there that, you know, it's the places that have oil, for instance, that have weaker institutions, and therefore that could be what's driving it. Even when you take that into account, that doesn't seem to be what's driving this difference, right? So again, our explanation is what drives this difference is the fact that, you know, you have the demand in some cases and you don't in others. So then we looked at student surveys, and we thought, okay, if this is true, then when we look at the Arab world, so now we're trying to hold some, I have issues with thinking with this way, but some set of kind of regional or cultural things in common. When we look at the oil-rich and non-oil-rich Arab countries specifically, we should start to find that in the oil-rich countries, the students should report differently about things like, does it matter that you do well in science in order to have a better future? Does it matter that you do well in math in order to have a better future? Do your parents care about whether or not you study? Right? So we look at those individual questions. We compare the oil and the non-oil countries, and we see that in the oil countries, students generally report, and there's also, by the way, parent surveys and administrator surveys. We thought the students would be less likely to try to essentially kind of hide the true feelings and the expectations about their parents. But we found that parents are reported to pay less attention to schoolwork. That students, whether they're asked about science, or whether they're asked about math, are reporting that it doesn't matter very much for their future versus those who are in the non-oil-rich countries. So policy implications, just really briefly. The first one is that I think obviously we need to pay close attention to context, but this is telling us to pay close attention to a particular thing in context, and that is how much does it actually matter to those who are, who are presuming are demanding these services? How much does it matter to them that they actually obtain them? The second thing, and interestingly enough, the UAE in particular has figured this out. If you want to get people to sort of, demand something that they don't think they necessarily are interested in, you need to provide individual incentives that matter. So they're actually doing a lot of things with providing their tablets and smartphones and all sorts of incentives to individual students to try to get them to have better outcomes. And the third thing, and this is a little bit apart from the work, but I still think extremely important to pay attention to, is this expectation, this assumption that we make that when we're measuring outcomes, that we're measuring service provision, and particularly that we're measuring institutional effects of service provision. I hope that's helpful.